A very good morning. My name is Sharmila, and I am a student in PhD in Physiotherapy from Faculty of Health Sciences, UKMKL campus. And the title of my presentation today would be The Effect of Multi-Component Training Module for Family Caregiver of Persons with Parkinson's Disease, a Systematic Literature Review. And this is the title that I would be presenting for i-Sihat 2020. As mentioned earlier, my name is Sharmila, and I am the student of the Associate Professor Dr. Nur Azlin Muhammad Nordin and also Professor Nurlina Muhammad Ibrahim. So, before we begin any further, let us look at what is Parkinson's disease. As many of us are aware, Parkinson's disease patients would be presenting with tremor. They would be having dyskinesia, which means abnormal of movement and slowness of movement. And at times, they would also have cognitive impairment. If you were to look at the prevalence and burden of Parkinson's disease, you can look at the global prevalence of Parkinson's disease as of 2016 statistics, which is of 6.1 million. Ladies and gentlemen, those figures are alarming. When you look at Malaysia, the prevalence of Parkinson's disease in Malaysia as of 2016 is reported as 19,586 with death count as 514. However, what is more worrying here is this number is expected to manifest 5 times by the year of 2040, which is to bring about an increase close to 120,000. And this is something that we have to look at on how we can manage this effectively, because as of today, there is no cure for Parkinson's disease. When you look at the disability adjusted life years, when we talk about a condition, it is not just about whether we can benefit from the therapy, but we are looking at the number of years that is lost due to the disability that is caused by the disease. And in this case, it would be Parkinson's disease. You can look at 3.2 million disability adjusted life years and with more than 200,000 reported deaths worldwide. And in Malaysia, if you look at the number, it is expected to increase close to 20% from the year of 1991. And I'm presenting in front of you, ladies and gentlemen, a model called the Freeman's Continuity of Care Model, which serves the basis of why are we doing this literature review. Because when you talk about literature review, it is serving as a compilation of data and information. But what is more important is we would like to understand whether those data that we have is sufficient to answer or to provide or to close the gap that is present at the current management of Parkinson's disease. So if you were to look at this model, ladies and gentlemen, you can see that there is a secondary prevention, there is an exercise promotion, health literacy, which means we are encouraging our family caregivers, our Parkinson's disease patients themselves to understand what is this disease is all about. Most importantly is the continuity of care, and it's not just stop at the hospital, because Parkinson's disease is a neurodegenerative disease, which means we are expecting the condition to deteriorate over the period of time, and we would like to make sure that our patients and caregivers understand what are they expecting in the nearest future. And if you look at the PCA, which is the Parkinson's Care Advocate, you could see there is a management. We are looking at informational, societal, relationship, volitional, and it's a comprehensive, holistic approach that we are looking at. With this in mind, we are asking ourselves a question when we conduct this literature review. What is the effect of a multi-component training module for family caregivers and persons with Parkinson's disease? And the research objective is to systematically evaluate the effect of multi-component training module for family caregivers and persons with Parkinson's disease. The study design, as mentioned earlier, it would be systematic literature review, and the data sources are mainly from three databases, which is the Google Scholar, PubMed, and Cochrane Library, and the search was conducted between November 2021 and July 2022. As of the study selection, the title, abstract keywords, and full text screened for eligibility. The inclusion criteria that we looked at upon screening for the eligibility would be, number one, it has to be full text. The studies should be either interventional, it should be evaluation, or it should be at least a review by itself. And we only included studies from 2009 until 2022, and only in the language of English or Malay, because it has to be understood by the author, which is summarizing the data. And of course, the study, which consists of multi-component training or program provided to either the patient themselves or to the caregiver to be provided to the patient, are included. So for the data extraction, based on the selected articles, the authors extracted information on outcome measure. This is important because it has to match with what we are observing. For example, is there any evaluation on quality of life, caregiver's burden? Is there any evaluation on the, for example, the functional mobility, the functional outcomes of the Parkinson's patients, and etc. And number two, we are looking at the intervention. Like I've mentioned earlier, the studies either has to be an interventional, it has to be either evaluation, or it has to be a review. And in this case, we are looking at what sort of intervention they have used to come up with in their study. And the settings, because we are looking at whether there is any availability of module in home setting. So we are looking at the settings as well, and of course, the results for tabulation. So as I've mentioned earlier, based on the eligibility, based on the extracted information, 852 papers were generated. And if you could look on your right-hand side, which has a flow chart, there are a few keywords which are used. For example, Parkinson's disease and either family or caregiver. It has to be either a training or program, and certain keywords, for example, mobility, functions, quality of life, knowledge, or even burden. And based on these keywords, 852 papers were identified, and 842 papers were excluded in the screening process as it did not meet the eligibility criteria. And then only 10 papers were included. And of those 10 papers, we have 2 evaluation, we have 1 review, and we also have 7 experimental studies. So you can see there are about 10 papers we have identified, as mentioned earlier. And if you could look at the top, I have put in few flags, as you can see, and it's quite interesting to map it out because we have papers from United States of America, we have papers from Iran, we have papers from UK, United Kingdom, we have papers from Sweden, Netherlands, and China. And we can see a clear image that our Malaysia, our beloved country, has not yet produced a training program which is multi-component and structured yet. So this clearly shows that, especially in Asia, it's apart from China, it's quite lacking. And if you look at the review of the findings, okay, studies include number of Parkinson's patients as small as 39 patients all the way up to 140. And majority of the patients are in between of stage 1 to stage 3. And all interventional studies are focused in providing the therapy and program in either an institutional based or it would be hospital based, but none were home based. And if you could see, a review by Kessler and Liddy in 2017 reported very minimal studies out of their many studies that they have reviewed, included caregivers or family members. And I would like to summarize here, yeah? Most studies evaluates quality of life, all right? But we are not looking at studies which are evaluating the functional mobility or the functions of the Parkinson's disease patient. Perhaps I would maybe suggest that this is also looked at, because we would understand, yes, Parkinson's disease is a neurodegenerative process. However, we have to help to delay the process, even though we cannot reverse the process, to make sure that our patients can enjoy their remaining lives with independence and dignity. So this is review findings of summarized intervention. You can see there are mainly four frameworks, or I would say four model that our authors have actually formulated their intervention based on. For example, we have the PEPP framework, which is the patient education for Parkinson's patient, where it's mainly talking about the psychosocial intervention. It has the 8 sessions of PEPP with 90 minutes each session. And when you look at the next one, which is the self-management model, we have the 3 months, 3 modules, Hertfordshire Neurological Services Self-Management Program. We have Strive to Thrive Self-Management Program. We have Swedish National Parkinson School, where we talk about the component of mental, physical, and etc. Then we also have group rehab and education, which is a 30 minutes, 8 weeks session, and with, of course, an inclusion of 45 minutes of interactive dialogue, because mainly we want to have an improvement in terms of the knowledge that is perceived by both the caregivers as well as the patients themselves. Last but not least, we have the family-centered empowerment model, where Bagheri et al. 2019 is emphasizing the importance of family caregivers in improving the life and improving the functions, especially in terms of the mental aspect of the patients. So to answer to the study objective, what is the effect of this training module for Parkinson's disease patients or their caregivers? Number one, improvement in quality of life has been reported in close to 5 papers reviewed till date. Number two, reduction in caregiver burden is quite popular too, with 4 studies reporting on it. The next one, the ever first study, I would say, by Campo et al. 2010, which talks about whether such program is actually feasible to be conducted in Parkinson's disease patient. Yes, it is feasible. And the fourth one, mental relaxation is observed in both patients and their caregivers by Lyons et al. 2020. And the next one is the elevation of mood and coping skills by both the caregivers as well as patients are observed. Hence the conclusion, what is known till date? Number one, there are existing educational programs, as we have seen. Number two, most training programs are invented and conducted mostly in Western countries. Number three, majority studies focuses on primary outcome other than functional abilities. As you have seen earlier, it's number one, the caregiver burden. Number two, quality of life, coping skills, mental relaxation, but none talks about the functional abilities of the patients themselves. Number four, limited comprehensive education plus training program in Asia, specifically Malaysia. Hence, what are the gaps that is presented to be addressed by future randomized control trials or interventional studies? Number one, there are no standardized family caregiver training module in Malaysia. Number two, variation in studies with majority of no inclusion of family caregivers. Number three, no study using caregivers had evaluated functional ability, as I've already emphasized in the known conclusion. And number four, lack of multidisciplinary program, because when we talk about a multidisciplinary, it has to be of a psychologist, neurologist, physiotherapist, speech language pathologist. However, most studies have either one or two components and not a comprehensive multidisciplinary training program. Ladies and gentlemen, that's the end of my presentation. Presenting to you is the first slide of the references. And this would be the second slide of references. With that in mind, thank you for listening to this presentation, and the findings of this study is beneficial for future studies, either an interventional studies, especially for randomized controlled trial, to take the gaps and to address them wisely in their study for the benefits of the Parkinson's disease patient and their caregivers. And this is not just a literature review, but this is a groundwork for a better and outstanding randomized controlled trial to address, remember, ladies and gentlemen, the 120,000 Parkinson's disease patients which are expected in 2040. And that's the end of me. Thank you.